Okay. Oh, well. So, uh, again, thank you for
Yeah, no problem.
doing this. My first question is, tell me about yourself.
Yeah, it's pretty broad, huh? Yeah, I noticed
Right?
that question. Yeah, it's just like career-wise, excuse me, I'm a APRN in psychiatry. Basically, what I started, I was going to go in the military right out of high school, and then I ended up going or getting into nursing school, kind of out of influence mostly from my grandmother. She was a nurse her entire life, so it kind of influenced me to become a nurse. And I graduated nursing school from the University of Toledo, got my bachelor's in nursing, and then right out of school, I started working at the Ohio State Medical Center, the Wexner Center. I did that for about a half a year and realized that bedside was just not for me, which I think some people have. You either really like it or you really dislike it, which is fine, for people that love it. But I knew it wasn't for me for multiple reasons. Just feel like I had, you can grow a lot horizontally in bedside. You can learn different specialties, but I kind of knew that I wanted to continue my career anyway as an APRN. So left bedside, became a psych nurse at Unison Health in Toledo. Moved back to Toledo, and then haven't looked back. Really, I started exploring options for leadership roles as well. I was also thinking maybe sales, but again, I ended up being a psych nurse, and that led me to start my psychiatric nurse practitioner program. I like to think myself as, I guess, more about me. I guess it's a compassionate, driven provider. Hobbies include studying. I still really enjoy studying psych stuff, whether it's just small articles and whatnot. But enjoy golfing and hanging out with friends, normal stuff.
Well, I didn't know that about the you were originally in bedside. I thought you were always in psych.
Yeah.
So you kind of...
Yeah, no, I started in the float pool,
Gotcha.
Which was great, and it also wasn't great. It was quite overwhelming to start in the float pool. I wouldn't advise people do it right out of school just because it's, again, just overwhelming, especially at the Ohio State Medical Center. And I think I learned, obviously, medical was like 3 months, and then surge was 3 months. And I think I trained on like 12 different floors.
Yeah.
So it was a lot, and just remembering every single specialty, whether it was wounds or, there's so much different ortho. It was endless. Each floor went on, so.
Yeah, that is a lot. So you kind of answered question number 2 about the position and specialty. So my third question is, do you see an APRN influence in today's healthcare system? If so, how, and if not, why?
Yeah, absolutely. I think just like positive aspect, I see huge influence, just mostly being biased because that's what I am as an APRN, but I think specifically the influence I see the most, might sound cliche, but is filling the gap for providers. We know there's huge disparity right now, whether it's urban or rural. I think I really don't see too many negatives or like a negative influence on it. There's been multiple magnitude of studies that have shown the efficacy of APRNs and the influence they have, their trustworthiness, and I think another big influence, not just filling the gap, but I guess on another note is reduction in healthcare costs. Maybe another cliche one, but it's a big influence, I think, for providers just in general, and just healthcare. Everybody wants to save money. It doesn't mean you're getting less care. It just means, we're doing something right.
I totally agree. That's a number one reason why I wanted to be a nurse practitioner. So the next question is, what are some of the barriers that APRNs face?
Yeah, I thought that was a good question. I think I just like to start any position, any role, any career is going to have barriers. I think that's one thing that we need to keep in mind. in regards to, right, there's always going to be room for growth no matter what career it is, I think. I think what matters, though, most specifically probably is hopefully we continue to gain that autonomy and because it's one thing that has dramatically improved over time. States are starting to adapt the autonomy of nurse practitioners, and they're seeing the reduction costs. They're seeing how effective we are. And states, I think, need to adapt that even further because we really are in a medical crisis, whether we don't want to look at it that way or not, whether it's shortage of providers or just whether it's, COVID or even substance abuse treatment. The whole spectrum really can utilize having more NPs with more autonomy. With respect to MDs, I think, education is education. There's definitely differences in the way we approach, I think, certain barriers with that, but I think confidence is key. Another barrier can be yourself, really. I think, you have to, as an NP or provider, you can be your own worst enemy, and having confidence is key. Trust your skills, trust your education, and it's the sky's the limit. So.
Absolutely. Yeah, that's a good question. I wasn't expecting that answer. But yeah, that is, autonomy is a huge barrier I feel like APRNs would face. So my last question is, what change would you like to see made for APRNs? Speaking about autonomy, is that one of them?
Yeah, definitely. Autonomy is one of them. To a certain extent, I don't think, there's always, how do I want to put this? There's always going to be a leadership role. And I think regardless of whether it's APRN, MD, or, I'd like to see just more nurses, more leadership roles. I know there's already a ton in leadership roles, but to see that growth is really cool to watch. I myself would want to get into more leadership roles and get more involved, whether it's with legislation or, whatever. But one big change I noted, just for the question, I think, is having one unified name for APRNs. I'm not a huge fan of DNPs calling themselves doctor without any disclosure that they're not an MD. Mm-hmm. And there's also just a lot of confusion, I think, in the healthcare world, whether it's the patients or even providers. Sometimes there's confusion. What specifically we do, who we are, and what we can do. Mm-hmm. I just think having that unified name for APRN would be really beneficial. It distinguishes us, and I think us meaning that as nurses, and not saying that one career is better than the other, but I think having that change would be crucial because, again, of that confusion that is just seen with so many people, whether you're a PA or MD or DO, or I think that'd be one thing. What's another one? I think maybe continued adaptation to APRNs accepting NP fellowship roles or internship mm-hmm. roles, just like RNs are. Yeah. Especially FNPs. I think I'm a little biased being a psych mental health nurse practitioner because ours was so specialized, mm-hmm. As compared to like Peds or Jerry. But I think FNP in general, I think they should have specializations as well, like subspecializations. Yeah. Just because it's so broad at the breadth of what you can do as an FNP is endless, and it should be for growth. But I think accepting those the normalcy of fellowships or internships would be a good change.
Yeah, that's a really good point about having FNPs having to do the fellowship and having more of a specialty. So that's really all of my questions. So I really do appreciate the time that you took to join me on Zoom. But yeah, thank you so much, Seth, and I think you are a great provider, number one. Number
Thank
two,
you.
you provided a lot of good insight. So thank you.
No problem.
All right. You take care.
See you later.
Bye.